is Rohini, and I'm a fourth-year medical student. Today, I'll be talking to you about social determinants of health in older adults. This video is designed to help you identify resources within this domain. As future healthcare professionals, your knowledge of this topic can set you apart from your peers and have a large impact on the health of your patients. According to a JAMA article, the diagnostic workup and treatment that I've been learning for the past 4 years can only impact 10% of a person's overall health and well-being. Meanwhile, social and environmental factors contribute up to 20%. In older adults, this 20% becomes even more important as many people in this population live below the federal poverty level, putting them at higher risk for inadequate nutrition, lack of access to transportation, diminished savings, and job loss. This can be complicated by limited physical mobility and lack of social support. Many low-income seniors are not aware of financial resources that are available to them, such as discounts on property taxes, affordable housing options, food stamps, utilities assistance, prescription assistance, and employment programs. Importantly, even if a patient lives independently in the community, this does not mean that they aren't struggling with activities of daily living, which could be easily addressed by available community resources. In this study, 33% of community-dwelling older adults identified a self-care or household activity need. Fortunately, the Council on Aging in Middle Tennessee has shared this easy-to-navigate resource guide that you can share with your patients if they identify any of these needs. This resource is also available online. Here is a list of searchable services that are often available at free or reduced price. Some commonly identified needs are caregiving services, employment, food, and transportation. Let's say that Miss Smith walks into your geriatrics clinic. She is a 68-year-old female with a past medical history of congestive heart failure, type 2 diabetes, hypertension, COPD, and arthritis, who lives independently in a ground-level home in Franklin. During your assessment, you discover that Miss Smith needs assistance with food preparation and shopping. She is able to manage her finances and medications without assistance, and she does not need assistance with ADLs. Of note, Miss Smith has also had a 10-pound weight loss in the last 9 months, despite having a normal appetite and otherwise negative workup. Her son has also had some concerns about her living at home. She asks you for your advice on different care settings. You show Miss Smith how to search the Council on Aging's database and print a list of meal preparation agencies. You also encourage Miss Smith to call the food stamps office because you know that many elderly adults are eligible for food stamps but are not yet enrolled. You also suggest that Miss Smith complete the 4-minute rubric assessment with her concerned son. This is a tool offered by the Council on Aging to help older adults identify care settings appropriate for their needs. Miss Smith and her son can answer a few interactive questions, like this one, which asks, is your mom likely to forget the names of friends and family or how to do things like use the phone, TV, or thermostat? Then, Miss Smith can compare different options based on her results. I hope that this presentation has helped you identify resources for other patients like Miss Smith, so that you can better address patients' social, environmental, and health needs. Thank you.